And welcome to Can Cable 21. You are watching a live show brought to you by Can TV. For the next 25 minutes, we're going to be talking about heart disease. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare, a program of Advocate Illinois Masonic Medical Center. Thank you for watching. Please note that at the bottom of your screen, you have a telephone number. If you have any questions regarding anything that we're talking about today, please give us a call. The number's at the bottom of your screen, area code 312-738-1060. So joining me today is Dr. Ellen J. Bell, cardiologist with Advocate Illinois Masonic Hospital. Thank you for being on the show.
Thank you, Lucy. Glad to be here.
Well, I know we're really excited because there's just so much information to share today, especially in heart disease. And I couldn't find somebody else with the energy that you have and the knowledge that you have, and I can't wait to share that with everyone. So Dr. Bell, I want to ask you, and I know we're starting this in English, but we're really going to go into a Spanish show, or we can redo this again at another time in Spanish.
Sure, yeah.
All right, so why don't we just go into English then? So Dr. Bell, cardiovascular disease is a general name for a wide variety of diseases. And we know that the condition affects the heart and sometimes the blood vessels of the wall, as well of the heart. Cardiovascular disease is the leading global cause of death. Latest statistics are that accounting for about 17.3 million deaths per year, a number that is expected to grow to more than 23.6 million by 2030. And about 2,100 Americans die each day from these diseases, one every 40 seconds. Doctor, what is going on with heart disease?
Yeah, Lucy, as you well explained, these numbers are really scary. A lot of people are dying from cardiovascular disease. Actually, if you take account all the deaths that occur in the United States, cardiovascular disease is the number one cause of death. You can bundle up trauma, cancer, and pulmonary infections, and still cardiovascular death is a major cause, and it affects men as women. And this is very scary because the numbers are just piling up every single year. We see that every 40 seconds, since we started this program, somebody probably already died from a cardiovascular death. Every 40 seconds, somebody's dying a day. 2,200 people dying daily from cardiovascular death. And, and when I say cardiovascular death, what does this mean? Because cardiovascular disease involves a big spectrum of diseases. It can be hypertension. It can be coronary artery disease, which is blockages in the arteries of the heart. It can be strokes, which are caused by blockages in the arteries of the brain, or by clots going to the brain, or from bleeding into the arteries of the brain. Also, cardiovascular disease involves blockages in the arteries of the legs. It can involve irregular heart rhythms, problems in valves in the heart, structural problems. So there are a whole bunch of diseases that involve cardiovascular disease, and it's the numbers are increasing every single day. And something that we have to look into is who are at risk to have cardiovascular disease. So everybody, men and women above 40 years old, people who have high blood pressure, people who have high cholesterol, people who have diabetes. Right. This is a population who are very likely going to have cardiovascular disease, and they should be seen by their internal medicine doctor or by a cardiologist. And sometimes when people think about a cardiologist, they think they should only see a cardiologist when they have problems with the heart. Right. They'll never think about going to see a cardiologist if they have high blood pressure or high cholesterol. But indeed, we see all cardiovascular disease, and this involves problems in the arteries of the heart, arteries in the legs, arteries in any part of the body.
And obviously, and as you mentioned, and the blood flow as well. It does, when it's going through, and then there is problems with blood flow. Is that part of it as well?
Absolutely. I mean, blood flow is a major component of cardiovascular problems. Actually, I'm an interventional cardiologist, and what I do is that I diagnose and I treat problems in blood flow in the coronary arteries. So what happens if you have an artery in the heart, and as people age and are exposed to either diabetes or high blood pressure or high cholesterol or to bad diet, then these arteries can be clogged up with cholesterol, with inflammatory cells, and all these things that can cause blockage in the arteries of the heart and eventually decrease blood flow, causing heart attacks, causing ischemia or decreased oxygenation to the blood. So, and part of my job is trying to open up these arteries with stents. It's a procedure in which we go into people's arteries in the wrist or in the leg, and we go all the way to the heart, and we try to look for blockages and try to treat them with balloons and stents.
Right. So, doctor, why is it that sometimes some people don't have symptoms?
That's a very good question. So, first of all, let's talk about, before I can answer that question, Lucy, I have to tell you, what are the symptoms of having blockages in the arteries of your heart? So, these symptoms may vary. The most common and typical symptoms are chest pain. Now, this is really tricky, Lucy.
Right.
A lot of times, I'll give you one example. I was a medical student. I was living in Honduras. It was a Sunday. I was watching TV all day, you know, and then my mom comes over and she tells me, you know what, Alan, your dad's having jaw pain. And I'm like, really? You know, as a medical student, all of a sudden a light bulb just flashes in my head. And I asked my mom, how long is my dad having this jaw pain? It's been going back and forth. Does he have any chest pain? And she
Really?
said, no chest pain, just jaw pain.
Okay.
All right. And then as I asked him more questions, he told me that he had a mild chest discomfort. He wasn't having a chest pain. It was a pressure. So, you know, and this is the most common symptom. And when you have blockages in your arteries, it's a chest pressure. It's a pain, but people a lot of times describe it as a pressure, a tightness, a heaviness. And, you know, and being a medical student, you can't imagine how scared I was when my dad was having a coronary right in front of my eyes. So, so a very common symptom is chest pressure. It can be heaviness, it can be a discomfort, an ache, and this can be causing in the chest. You can have it in your jaw, in your shoulders, in your back, in your upper abdomen.
Right.
And associated to this, you might have sweatiness, you might feel short of breath, you might feel flushed. And a lot of people, the most typical symptom is described as somebody when you feel you're about to die. It's a really horrible sensation. But sometimes you may not have any symptoms at all, or you may have really atypical symptoms. And for some reason, this is common in women and in diabetics. There are some people who actually have heart attacks and they never thought they have a heart attack. Either they thought they were having indigestion, maybe all they felt was upper abdominal pain, maybe all they felt was upper back pain, and they could never imagine they were having a heart attack, but they did have a heart attack. So sometimes, Lucy, the symptoms are atypical, they're not common, or sometimes you may not have any symptoms at all, especially if you're a woman, if you're diabetic, or if you're old. The elderly tend to have symptoms differently than the other population.
And I also know that women have different symptoms than men sometimes as well.
Yes. Again, women may have more atypical symptoms. What I tell my patients is this. If you're 40 years old and above, and you have discomfort somewhere between your upper abdomen to your neck area, you cannot take it seriously. You cannot, especially if you're short of breath, if you get sweaty, if you feel your heart racing, and you feel dizzy, you probably have to go to the ER.
Right.
You should, especially if you're having chest discomfort, even if you think it's indigestion, even if you have a good Hispanic meal, and you have like a nice, nice enchiladas or something really spicy, and you're 100% sure it was heartburn, but if that discomfort lasts for more than 5-10 minutes, you should probably go to the ER.
Wow.
Yeah, and don't try driving to the ER like my dad did. What he tried to do is just call 911 because it can be unsafe to drive to the hospital yourself if you're having a heart attack. And you'll be surprised how many people actually drive to the ER when they're having a heart attack.
So when, Dr. Bell, when you're having a heart attack, does it cause permanent damage?
That's a very good question, Lucy. So time is the essence. So what happens when you're having an acute heart attack? Well, a heart attack means that one of the arteries in your heart are completely blocked or nearly completely blocked. And the most dangerous or the higher risk cases, it's 100% blockage. And what this means that there's no blood flow going to a certain part of your heart. And the longer it takes to open up that artery or to resume blood flow, then the higher the likelihood of having permanent damage. So the faster you open up the artery, the faster that heart might recuperate. So if you take too long to come to the hospital, it might be too late. For example, if we know that if that artery has been blocked for more than 12 hours, it's very unlikely for that part of the heart to be recovered. So the sooner you come, if you come to the hospital within 30 minutes, and that artery will be open really soon, then it's very likely that your heart will be completely normal.
So it can heal.
Absolutely,
Absolutely.
absolutely.
Okay.
It's just very important to seek medical attention as quick as possible.
And a big part of that, of course, is, receiving the treatment after a heart attack, lifestyle changes, which is really hard to do for a lot of people.
Absolutely, absolutely. So, what's the immediate treatment? So, the immediate treatment, when you're having heart attack symptoms, the very first thing you should do, obviously, is you call 911, and you'll be seen by paramedics, or somebody in the ER will eventually give you aspirin.
Mm-hmm.
You'll get different types of blood thinners. You might get a second type of blood thinner that's different, stronger than aspirin. Maybe people have heard of the word clopidogrel or ticagrelor or prasugrel. Depending on what kind of heart attack you're having,
Right.
you might need an emergent cardiac catheterization. And that's a procedure that I was talking about a little bit earlier, is that when you go into the artery of your leg or your wrist, and you go up to your heart, and you look for the blockage that's causing the problem.
Sure.
And then you try to open up the blockage with a stent. A stent is like a metal scaffold, and what it does is it pretty much crushes the blockage, and it creates passage of flow in the coronary. And then once you put the stent in there, the patient has to be in a whole bunch of medicines.
Okay.
They have to be on aspirin, low-dose aspirin for life,
Okay.
one daily. They have to be in a second blood thinner. It can be something clopidogrel, also called Plavix, prasugrel, also called Effiant, ticagrelor, also called Brilinta, and they typically have to take these for a whole year.
Okay.
On top of this, have to be on cholesterol medicine. And it doesn't matter if your cholesterol level is normal. If you have coronary artery disease or any blockage anywhere in your body, then you have to take cholesterol medicine for the rest of your life, if you can tolerate it.
Really?
And on top of those three, so I've already had 3 medicines, right?
Wow.
On top of that, if you had a heart attack, you have to be on 2 more.
Really?
2 more medicines that will help your heart function. These medicines also used for blood pressure, but they also prevent scarring in the heart. So if somebody has a heart attack, they'll be on 5 medicines. Now, these medicines, most of them have been proven to help you live longer. All right? Now, I can give you all the medicines in the world.
Right.
I can put the best quality stent, I can do the best procedure, but if you don't change your quality, your lifestyle,
Right.
you'll be back. You'll have more heart attacks, you'll require more stents.
Right.
So the key thing is changing your lifestyle, and that's really the most important thing. Lucy, I love my job, but I get so surprised that every day I'm seeing younger people needing stents. I'm 35 years old, and I've seen people who are 33, 30 years old
Oh.
getting stents for severe blockages in their arteries of the heart. And that's concerning. So, I really believe that we have to change our lifestyle. We have to watch what we eat. We have to exercise. And that's something that's really easily said than
Right.
done.
Right.
But we're eating too much junk food, too many fried foods,
Fast foods.
too much red meats.
Yeah.
We're not exercising at all. So all these, increase our chances of having blockages in our arteries.
So, of course, there is recovery from a heart attack. You can recover.
Absolutely, you can recover if you come quickly to be treated and you get the appropriate treatment, which involves certain medicines and possibly a stent. You might have full recovery. After a heart attack, when you're discharged from the hospital, you might need something called cardiac rehabilitation,
Okay.
in which you do tailored exercises in a skilled facility.
Okay.
And you do exercises in a moderate setting, and you pretty much get comfortable in exerting yourself, and you're monitored. So
Okay.
that's part also of the therapy. And after you get a heart attack and you got all the therapy that you needed, you still have to see a cardiologist for the rest of your life, once or twice a year.
Okay. I do know that not all chest pains are a heart attack. And so, Dr. Bell, one very common type of chest pain is called angina. Can we talk a little bit about that?
Absolutely. So when we talk about angina, we're talking about pain caused from blocked arteries. That's the pain we're talking about, from very similar to the heart attack.
Right.
All right. Now, when you have your typical angina, usually lasts somewhere between 5 and 15 minutes.
Okay.
All right. When you have, this means that you may have an artery in your heart that has a blockage between 70 and 99%. But when that pain lasts for more than 15 to 20 minutes, it's either
Right.
unstable angina, or it can be just a heart attack itself.
Ah.
All right. So when the pain is prolonged more than 20 minutes, that's concerning for a heart attack. Now, like you well said, there are many types of pains that are not heart pains. So it's very challenging, because in your chest area, you have skin, you have bones, you have cartilage, you have lungs. So a lot of things can be causing pain. All right, you have your food pipes, you have your windpipes. So a lot of stuff can be causing pain. People can have a bad bronchitis or pneumonia,
Right.
and they can be coughing all day, and then they have pain every time they cough. People may have, maybe they lifted something heavy, and maybe they pulled a muscle and they can have pain in their chest. So sometimes it can be really challenging to know what your pain is. Or maybe they had that spicy Mexican food we're talking about, and they have pain after that. So it's really, well, you're Puerto Rican, right?
Yeah, I know. But I still like the spicy stuff too.
You like I love spicy
There's a lot
food.
of fat in our food.
Exactly.
Even though I cook very healthy.
Yeah.
But I know that when we talk about these things, and that's the challenge with lifestyle changes, especially if you're typical and you love eating all your foods and it's really hard. But that doesn't mean you still can't eat your food. You just have to make some changes to your recipes and just healthier recipes.
Yeah, and I would advise on portion control, and that's probably very hard.
Right.
You know I have a big Hispanic population, so and I see a lot of Central American people, and a big portion of the Hispanic diet is tortillas, for example.
Right.
And I love tortillas. I can go down to 8 tortillas at lunch easily. So what I tell my Hispanic patients or anybody at all, if you eat 8 tortillas before, now cut down to 3.
Right.
If you like bread, if you eat 4 loaves of bread, go down to 2. It's all about portion control at the beginning,
Moderation, right.
And then, but you have to challenge yourself. Once you be able to control portions, then you have to go with quality.
Right.
Avoid pop. You know, even Diet Pop, Lucy. Diet
Right.
Pop is really bad, and there are some studies now that are associated with cancer. All processed sugars are bad. Red meats are associated with stroke, with cardiovascular disease, any type of red meat, Lucy. So, and if you guys want to eat protein, I mean, I'll advise you chicken breast, fish, no skin, no oil, no butter. It cannot be fried. I advise grilled, baked, or boiled. You know, veggies. A good thing about green veggies, you can pretty much eat as much as you want.
Right.
You have to be careful if you're in a medicine called warfarin, though. If you're in a medicine called warfarin, you cannot eat green vegetables. Otherwise, you can eat as much vegetables as you want. But, you know, water is a lot of water. I would avoid sugary drinks,
Right.
anything artificial. If you have diabetes, I'll be very careful with orange juice or fruit juices. Sometimes we think that orange juice is healthy and we can go down a whole liter of it alone.
But you also hear, doctor, I mean, at least I hear this every time I see one of our patients or in community when we're doing events. What comes up is, oh no, that his sugar fell. So what do we? First thing we do is we run and we give him a large glass of orange juice.
Oh yeah, when the sugar falls.
A little sugar level.
Exactly. Yeah, orange juice has a lot of sugar. So if you have diabetes, you probably should avoid it. Yeah.
Wow. So Dr. Bell, I do want to remind our viewers, let me go back. I do want to remind our viewers that our lines are open. If you have a question, please give us a call. The number's at the bottom of your screen. And if you have questions that you don't want to ask on air, please, we actually encourage you to call Dr. Bell. You can reach him at 773 area code 880-9722. And if you need to find a cardiologist, give him a call. He's there as well. And if not, you can always call Hispanocare for other referrals. We'll be happy to refer you to our many, many cardiologists throughout the city. So, Dr. Bell, there are other causes for heart attacks besides blockages. And I know you alluded to some of those things. And as well as the indigestion, when people are eating certain things, I mean, I'm one of those. The first thing I do is let me take a Zantac or take some Tums over. I ate something that didn't agree with me, and then I'm dying with heartburn for an hour or two. When do you run to the emergency room? And that's the hardest thing, is making that decision. When do you need to call 911?
Yes, that's a very important question. So if you've been known to have digestive problems, if you've been known to have acid reflux or esophagitis or ulcers, and you're having your typical ulcer pain and you're having something very similar to what you've been diagnosed before in the past and nothing has changed, then it'd probably be safe to take your usual measures, whether it's an antacid or whatever medication your doctor prescribed. But if you all of a sudden have a different pain, a different sensation, that's not going away with your usual measures, that's when you should start calling 911. If you're having chest pain in particular, I always tell people you should not have chest pain within 5 minutes. If that chest pain is lasting for more than 5 minutes, you have to call 911. If you have shortness of breath, if you get sweaty, if your heart's racing, if you feel dizzy, if you feel weakness in any part of your arms or your legs, if you feel that you need to pass out, those are symptoms they should call 911 immediately.
Don't hesitate. Please call 911.
Yeah.
Don't do what a lot of people do, and that is basically, I'll sit away, it will pass. Yes, it might pass, but at what cost to you?
Yeah, Lucy, I'll tell you an example. So I have clinic days on Tuesdays and Fridays, and I was on one of my clinics on Tuesday, and I saw this nice lady. She's in her mid 40s, and she was having pain since Friday, and she had pain all Friday, all Saturday. Pain eventually went away, and then I saw her on Tuesday, and what happened is that she had a heart attack.
Oh, my goodness.
And by the time I saw her, she was pain free because that part of the heart already had died, and there was no way to recover from that. And I couldn't give her any more to help her, and I felt
Right.
really bad. And I really hope it doesn't happen to anybody who's watching this. If you have any chest pain, if you have any shortness of breath, if you have any symptoms of heart palpitations
Sure.
or sweatiness, you really have to call 911 and get medical attention.
Wow. Well, heed the doctor's words. I mean, definitely, and these are easy things that can be done, and it's not rocket science. It's just really common sense. You feel something, you know something, follow that 5-minute rule. If it continues, please follow up and call 911. Very important. Dr. Bell, what are some of the other risk factors for developing cardiovascular disease?
So
I know you touched on some of them.
Yeah, the big ones are obesity, diabetes, and diabetes is actually considered a cardiovascular disease equivalent. High cholesterol, high blood pressure, and age. Those are the really big risk factors.
Wow. So we talked a little bit about the signs of a heart attack, and we know that sometimes the diagnosis for someone to be diagnosed for heart disease. So if you're one of those individuals who sees your general practitioner, but yet you're dealing with some of these other issues, and maybe you haven't shared that with your general practitioner, or just because you're at a certain age, at a certain weight, maybe it's just good to schedule an appointment with a cardiologist.
I think so. I think if you're a diabetic, if you have high blood pressure and high cholesterol, if you're above 40 years old, you should definitely at least be seen by a cardiologist once in your life to be screened for cardiovascular disease. And depending on what symptoms you may or may not have, you may get something called a stress test, an echocardiogram, ultrasounds of your arteries in the neck and the legs, looking for these diseases.
Right.
And the earlier we detect them, the better, because we can prevent far worse things from happening.
Absolutely. So, doctor, wouldn't you say that maybe these types of screenings and tests should be part of an annual physical?
So actually, we have guidelines regarding this,
Okay.
and we have guidelines that direct how often we should get these screening tests for diabetics, for people who have smoked in their life, for men above a certain age, and all primary care doctors are really good about these things, but particularly diabetics,
Right.
hypertensives, you have to eventually be seen by a cardiologist at least once in your life.
Absolutely. So, it's so important to learn the signs and even remembering that 5-minute rule. But what's really interesting, as you mentioned earlier with your dad, that he had jaw pain.
Yep.
Something that simple that led to something much more
Oh yeah,
serious.
yeah. He had jaw pain, and fortunately, that his blockages were only moderate, and we're able to treat him with medicines. But a lot of time, that's what happens. You have an atypical presentation, you have jaw pain or back pain, and you not know that you're having a coronary, and you don't seek medical attention promptly.
Right. Very, very, very important. Dr. Bell, our time here goes by so quickly, but I do want to remind our viewers again that if they have questions or they want to reach out, they can reach out to you, and they can reach you at 773-880-9722. Give them a call. If you have questions, feel free to reach out to him. And if not, you can always call Hispanocare, and we'll be very happy to help you out with that as well. So, doctor, I know that learning the signs and remembering what those are can save your life and, and maybe someone else you love. Very, very important. So don't wait more than those 5 minutes. Call 911 when you have to. Calling 911 is almost always the fastest way to get life-saving treatment. And as the doctor has said, don't drive yourself. That's why you're calling 911, to get you there safe. So, Dr. Beal, I want to invite you back. I want to have further discussion. There's just so much more to talk about, and not just heart attacks, but the heart as a whole. And have you back, and let's discuss even more.
Absolutely, be my pleasure.
Thank you so much for coming out.
Thank
Really
you.
do
Thank you for
appreciate
inviting
it.
me.
So I'd like to finish that. We all experience some health changes at a greater or lesser degrees at various points of our lives. Heart disease does not stop from you pursuing your ambitions. If anything, if you do have heart disease, You might have to change your lifestyles, but it doesn't mean that you cannot pursue your careers effectively, run a business, practice a sport, or even go on vacation. Heart disease takes the lives of far too many, especially when it's preventable. On behalf of Advocate Illinois Masonic Medical Center, Hispanocare, and my colleagues, Dr. Beal, thank you for coming today.
Thank you for having me.
Thank you so much for joining us today. Please stay tuned for more information coming your way to Can Cable 21. Until next time, have a good evening.